Let me make sure that this is working as I move on my Zoom, recording in progress. Yes, I'm so excited to be here. I know lots of you in this room, which is really exciting. But for those that I don't, I am going to spend some time today talking a bit about the NICU because this is a topic that is often missing from a lot of doula trainings. It's also something that comes up a lot more frequently than we expect, especially if you are working as a birth or postpartum doula. And we can be left feeling really unsupported and confused about how, as doulas, we can best show up and support both NICU babies and their families. So we already did this part, so I know where you are and where you're from. And today's lecture, I guess, or educational topic is called From Crisis to Comfort: How You Can Make a Difference in the NICU Experience. For those of you that don't know who I am, my name is Mary Farrelly. I am a certified level 4 NICU nurse. I've been a NICU nurse for about 13 years. I am a professionally trained doula. I also did my first doula training back in nursing school. So I've been a doula and a nurse for almost about the same amount of time. I am a nurse educator, so I help to create the curriculum and training for new nurses and families in my unit. I'm a mom of two. I have a 6-year-old and a 3-year-old, non-NICU babies, but we had our own kind of journey to parenthood, which has influenced my work as the NICU doula and as the founder of the NICU Translator. So, NICU Translator is focused on bridging the gap between the NICU and home and between doulas and other support professionals and becoming NICU informed. My dream is to create this whole network of NICU informed doulas and other support professionals who can provide truly individualized care and support that meet the unique needs of NICU babies and their families. Because as we're going to talk about today, the NICU journey really can change the trajectory of the really changes of parenthood and how families step into their roles as parents. And babies have their own story as they're going through the NICU experience. And right now, the NICU journey, what we do well in the healthcare system is helping babies survive, to get to discharge, to get home, the medical advances that even I've been around since the last 10 years or so that has changed who and how we care for NICU babies is really incredible. But right now, families are still just mostly surviving. They're not really thriving. And my firm belief is that doulas and other support professionals are truly the missing link into providing truly holistic and really care that brings more joy and less trauma into the NICU experience. So everything that I do from my bedside work as a NICU nurse to my one-on-one NICU work as a NICU doula with families where I specialize in that transition to home, to trainings like this is bringing more joy and less trauma to the NICU experience, and that's specifically through empowered education. Most people, including most of us probably in this room, don't have maybe you don't feel as confident in your ability to support NICU families because it is such a unique language, it's a unique environment. It's really closed doors. It's kind of like unless you've like been invited into this space, whether as a family or provider, there's really not a whole lot of information. It can feel really overwhelming and really confusing. But my mission is to bring this education both to the families and to people like us who are supporting families through this experience so we can have the tools, the knowledge, the resources to allow families to feel seen and supported throughout this journey and beyond. So, what we're going to talk about today in our workshop, we're going to go through some NICU facts and stats because I feel like it is helpful to know where we are so we can help kind of dream about where we can go. We're going to talk about how NICU families are quote unquote set up for perinatal mental health issues. And we're going to talk a little bit about what makes NICU babies different than regular babies because the NICU, again, it doesn't just impact the families, it impacts the babies as well. And then we're going to talk about how doulas and other support professionals are uniquely positioned to change this narrative and where we can really make the biggest impact. And then I'll have time for questions. So as Sally was saying, if people have like a burning question on a topic or they want clarification, just raise your hand, put it in the chat, but I'll also save some time at the end for kind of tying it all together. My disclaimer, this workshop is for informational purposes only. I am a registered nurse, but this is not construed as medical advice, and you should always check with your physician or encourage your clients to check with their own medical team before implementing information that you read here. I also, at the NICU translator, so I've used inclusive language, so you'll hear me use a mix of terms like parents, mothers, birthing people, partners, families, breast milk, breastfeeding to stay aligned with NICU protocols while recognizing that not everyone will identify with every word that I use, but I'm always open to learning and evolving as I continue to build out this education and training. So, NICU families feel overwhelmed, alone, and left out of the quote unquote normal postpartum experience. So many times I hear families say, I just don't really know where I fit in. Like maybe we're home from the NICU and there's a mothering circle in town, but I feel like my story is scary and people don't want to hear it. Or I really don't want to hear other people's stories of their beautiful, blissful home births because that's what I wanted. And my story was very different. They don't really feel like they have a safe place where they are truly understood and can be connected with informed and evidence-based resources too that are unique to their experience and to their needs too. So, by taking the time to become NICU informed, to do trainings like this, you're allowing yourself to create an even more inclusive and supportive environment so these families can actually heal and thrive and not just survive, like most experiences currently are for many, many families. So let's kind of dive into the basic NICU facts and stats. And um, I'm in the United States, so these statistics are specific to the US, but they mirror many other countries. I've done this different trainings for people all over the world. And the reality of NICU care, there are nuances depending on where you are in the world, but the themes are universal. And really the gaps tend to be better in some places, worse in others, but they're still there. So the work of a doula and a NICU informed doula is really the potential's there regardless of where you are in the world. That being said, in the United States, the NICU is a part of the story for approximately 1 in 10 babies. So, one of the most common myths that I hear, especially when I talk about the NICU in birth worker communities or postpartum doula communities, unless you've done this work for a really long time, is like, okay, the NICU's not that common, so I don't really need to worry about it. Like, it's not going to happen. My clients are low risk, so I don't need to know anything about the NICU. But the reality is it's 1 in 10. So that means if you're teaching a childbirth prep class and there's 20 people in that class, statistically, two of them will have a NICU baby, have a NICU stay. I mean, it's over 400,000 babies just in the US alone. Another common myth is that all these babies in the NICU are preemies. So there's this image, from Grey's Anatomy of everybody lined up in an isolette, and there's beeping and wires and these itty bitty tiny babies. And the NICU is more preemies, that it's statistically about 50 to 60%, depending on where you are premature infants. But that means that roughly half of admissions are term infants. So that can be really shocking for families and also for doulas. They might be like, oh, my client is 36 weeks. We're not a preemie. We're not in the NICU anymore. But the reality is that babies go from living in a bubble basically 24/7. Everything, they're kind of on autopilot in utero. Like they have a heart and it's beating, but it's not maintaining blood pressure. They have lungs, they're doing little practice breaths, but it's not exchanging gas. They have a digestive system and it's like making practice poop and practice pee, but it's not really doing much. And all of a sudden they're born, that cord is cut, and all systems have to just fire on and work. And the fact that it does work more often than not, 9 out of 10 babies do not need the NICU is kind of a miracle. But many babies do need this additional layer of support as they're transitioning from life as a little fish into life in the real world. And so oftentimes, especially for term infants, you're going to see admissions for reasons like respiratory distress. That's the most common reason for a NICU stay. Babies that are having a hard time breathing. Again, those lungs, they didn't know what they were doing. They were just kind of living their best life inside of the amniotic fluid. And all of a sudden they're supposed to turn on and sustain life. And sometimes they need a little bit of extra support, monitoring, and care. Another common reason for term admissions can be infection, whether it was during the birth process or acquired in utero throughout pregnancy. Jaundice is another common reason. Many babies have jaundice, but some babies, for different reasons, have a much more pathologic level of jaundice or a higher raising rate that might need additional NICU support and care. Low blood sugar is another common reason. Those are typically babies born to infants of a diabetic mother. But we know that sometimes we think like, oh, just gestational diabetes, but especially in the US, there's a much higher rate of type 2 diabetes that is diagnosed during or before pregnancy, or families that have type 1 diabetes as well. And then there's other reasons why a baby might have low blood sugar too that need support and monitoring in a NICU stay. And then another common reason for admission, especially for term infants, is congenital differences or congenital abnormalities. And these are the few families that may know prenatally that the NICU is going to be part of their story. There's a few other instances, maybe you're high risk for twins or something else is going on with the maternal health picture. But for most families, the NICU is very unexpected and it can happen really quickly. It goes from, I'm having a fine pregnancy and all of a sudden I'm 31 weeks and my water broke. Or everything's going fine and I start to bleed. Or the baby, I had a beautiful birth and a beautiful pregnancy and now the baby's having some respiratory distress issues and showing like maybe they have some pneumonia going on. And so it can feel really overwhelming for families, especially as we're going to talk about if the NICU was 0% on their radar, never talking about, never explained, never referred to. That shock can feel really intimidating. The average length of stay in a NICU is about 13 to 20 days, but some babies stay in the NICU for a few hours, and I've celebrated first birthdays before in the NICU. So that's a true average, but the average is 13 to 20 days. The average cost per admission is $50,000. A lot of families will kind of joke that they have $1 million babies, but they're not kidding. They're getting actual $1 million+ bills in the mail for their baby's stay. And you add surgery or two babies, more babies on top of that. So to add, these families are already postpartum, right? We serve post families going through birth and postpartum, and it's an incredible transformation and an intense period of stress and just transformation at baseline. And then to add the additional stress of the NICU plus this financial burden, it really sets up families for having higher rates of mental health issues. So it's estimated that about 70% of NICU mothers, the rate is also high. I don't have the exact statistic in this presentation for NICU partners, dads and partners, experience a maternal mental health crisis. Most commonly, we're seeing postpartum depression. Also, a lot of postpartum anxiety and postpartum OCD is much higher in NICU families than in the non-NICU population. And the average number for like a non-NICU family, the general population for postpartum PMADs is around like 20-ish%, 20, 25, depending on what research you're looking at. So the fact that up to 70%, and that's probably low, like every study that comes out, the number creeps up higher and higher and higher because for a while we weren't even allowing families to like have the space to know that they were in having an actual perinatal mental health crisis versus just I'm stressed from the NICU. So the rate is so incredibly high, and it also is linked directly to PTSD symptoms. So PTSD being post-traumatic stress disorder, about 40% of NICU families have clinical PTSD symptoms by about 14 months after birth. But of that 40%, only about 25% of them have symptoms of PTSD prior to discharge. And that number is very similar to PMADs as well. A lot of these families are not having true symptoms of mental health issues until after discharge. And so, once the chaos of the NICU and the noises and the overwhelm, once the fight or flight and the cortisol has kind of died down a little bit and worn off, that's often when these feelings are the family's finally able to like be like, oh my gosh, what did we just go through? And it can come and hit families really hard and really unexpectedly because they'll think, we got through the NICU. We're home now. Everything should be fine. And oftentimes this is when they're really left to struggle. And we're going to talk about that quite a bit. And that's one of the roles that I serve as a NICU doula specifically is helping with their transition to home, knowing that families are going from 24/7 nursing care and support and just have kind of like cold turkey sent home and be like, you got this, off we go. And that's another place where NICU informed doulas and care professionals can truly shine as well. So, NICU families, again, they just had a baby. They're still having massive physical changes, emotional changes, hormonal changes, psychosocial changes. They're adding a new human into their family. They're navigating siblings and other loved ones, and all the things that happen to every single person that has a baby, and all these changes are happening. And now they're dealing with this NICU stay. Even if the NICU is part of their experience for 4 hours, it totally changes how they're stepping into this next chapter of their life and of their journey. So, why? Besides the basics that we talked about, why are families at higher risks for PMADs? PMADs being perinatal mood and anxiety disorders. Wait, got it wrong. Um, why are they doing this? So this is my like kind of outline and of why this is happening, and it starts well before the baby is born. So the NICU family mental health journey is really set up way back from the beginning, like before they even knew they were really having a baby. So when people pee on their pregnancy stick and they get those positive lines, this is the vision. This is oftentimes what families are envisioning for their birth. It's blissful, it's connecting, it's skin to skin, the baby's right with you. It's beautiful and it's joyous and there's bonding and it's on your terms and it's a totally that idea of a golden hour and really facilitating this bonding and this journey. And this is really in especially our culture of social media, for better or for worse, this is what we are, quote, selling to families, which I think is beautiful. As a doula, I'm 130,000% on board with having families feel empowered to make their decisions, to have a low intervention birth, to have this vision of a birth. That being said, if what they actually are living is so totally different, it automatically sets these families up for really intense loss. If this was the only vision of what they think birth is and will look like. So for NICU families, their golden hour often looks like this. There's physical separation between them and their baby. It's bright. There's wires, there's tubes, there's oftentimes very minimal touch. And so again, there's this total literal Instagram versus reality sensation that no one in my circle told me that this could happen. So I must have done something wrong as the parent. I must have not prepared appropriately. I must have made a wrong choice along the way. I did something wrong. And we know that that's not the case, but the inner narrative of families who have a more intense birth and postpartum experience, especially if the NICU is involved, this is oftentimes how their brain is kind of spinning the story based on their prenatal experiences. So we have a culture of the perfect birth. Then we have this idea that most people do not know anything about the NICU at all. So the March of Dimes, which is this massive, everyone's heard of the March of Dimes. They are a very large nonprofit that does a lot of research related to NICU care, prematurity, infant health outcomes. Their most recent study saw that only about 10 to 15% of childbirth education classes and prenatal prep classes that they researched, hospital-based and non-hospital-based, even mention the NICU at all. And when they do, it says, hey, and our hospital has a NICU, period. It's not like, okay, here's why we might need one. Here's what it might look like if the NICU is part of your story, which again, it's 1 in 10 babies. So that means that so many people are missing this vital piece of informed and empowered preparation for their birth story. And oftentimes, when I bring this up to the doula community or others that are doing childbirth education classes, and even with families sometimes, they'll say, well, I don't want to scare my client. I don't want to fearmonger. And I don't want to fearmonger either. That is not where I'm coming from. When I talk to my own clients and birth doula clients, I always use what I call the fire drill model. So I have a daughter, she's in kindergarten. They do fire drills, right? They regularly practice what they would do if there's a fire. And it doesn't mean that they're manifesting a fire and now all my daughter can think about is fires. It means that if there is a fire, they're safe. They know who goes where, who does what, and they're going to have a better outcome if the fire does happen to them as part of their story. So I present NICU and contingency planning in a birth conversation from this lens, saying, hey, We're going to talk about this once. I have a template, it's a birth plan template. You can find it on my website. It's free, anyone can have it. And it talks about it's NICU specific and contingency planning. So we're going to talk about it one time. We're going to answer these questions and tuck it away. And then I know what you want, your partner knows what you want, and if the NICU is part of your story, you know a little bit and enough to feel a percentage more in control and empowered to navigate the NICU on your terms and in a way that feels good for you and your baby, while still making sure everybody's getting the medical care that they need. So that's one of my soapboxes is to bring more prenatal NICU education to every single pregnant person. Just a percentage. High risk people I think need more, but I feel like every single person should at least have a basic awareness. And if you don't know where to start, the NICU birth plan template is a great place to start there too. And I'll make sure I get the link out so that you guys, or you can go to my website too, which is at the end. Then there's the shock of the actual birth experience. Many NICU births, not all, but many are more dramatic and maybe even traumatic. So it might be a delivery that was going well, and then all of a sudden the baby has a massive decel, or there's a cord prolapse, or something's going on, or there's bleeding, or it's an emergency C-section. Sometimes, again, it is a very lovely low intervention birth and the baby needs more support, and that's a different version. But oftentimes, there's a level of shock from the birth, and families are really not given any permission to process their birth because they immediately go into the fight or flight of the NICU stay. So even when I'm working with families post-discharge, most of them have not even processed or thought about their birth at all. And that can also sneak up and start to like replay and have that type of PTSD window as well. So that's another piece of the puzzle that leads to families having these poor mental health outcomes. And now we're in the NICU. So the NICU itself has this culture and almost hierarchy of care where the family becomes the second tier care provider and the medical team, mostly the NICU nurses, become almost like the hands-on parent. They're the ones that are doing the hands-on skill and the physical care of the baby. And there's some level to that dynamic that is necessary because of the additional skills and training of the NICU provider team that are going to meet the medical needs of that baby in the moment. The baby likely has some medical needs, which is why they're in the NICU. You know, the NICU stands for neonatal ICU. It is an intensive care unit. But the culture really sets the tone for parents to immediately not trust their own instincts or be given space to even use them. They're often in the culture of NICU, there's rounds in the morning, they decide the plan of care for the team for the day, it's implemented, and then we tell the family. So there's not always this collaborative conversation, and we're working to change this, but oftentimes that is the reality that most families are working with within the NICU setting. Then we have disrupted bonding. As we saw in the picture, oftentimes that golden hour experience is completely disrupted. Sometimes it's a short period of time while the baby's getting settled in. Maybe they need some oxygen or some support, and then we can do skin to skin, but just delayed. Other times the delay is quite extensive, and then we still are dealing with physical walls of separation, lots and lots of rules and protocols, which are designed to keep these very vulnerable babies safe, but do disrupt the normal, quote unquote, normal bonding pattern, the normal postpartum hormone exchange that's really reliant on touch and connection and getting to know each other. It's different. And it doesn't mean that it's going to, totally change how it doesn't mean there's no recovery. And one of the big tenets of the work that I do with NICU doulas is to help families start to build in a balance. So for every interruption in bonding and every painful procedure, we introduce something that's physiologically positive and connecting and human. And so it automatically will balance these things out, but it is still different and it is still hard. And sometimes this might mean you're delayed in skin to skin. Sometimes it might mean your baby is in a hospital 4.5 hours away from you and they were flown there overnight and you don't even know where really in the state they are. And then you're now here and other children are here. So oftentimes I'll hear families say, like, at a certain point in their, especially for longer NICU journeys, they can feel like their baby isn't their baby. It's a baby and they like this baby and they're caring for this baby, but it doesn't feel like theirs. It almost feels like they are turning in their brain into a caregiver, into like a nurse, into a provider basically for their baby because of this environment that they're in. And it feels really awful to be in that space, and they don't want to voice these fears and feelings out loud, but it's really common to have this, and it's really linked to these little ruptures in bonding and trying to figure out ways to bring the family and the baby back together. Then we have truths to their concerns and anxieties. So if you have a typical non-NICU family, every new parent or any parent is going to have worries and anxieties. A NICU family might say, a non-NICU family might be like, oh, I'm really worried about my baby not breathing in the middle of the night or stopping breathing. And you can be like, look at your baby. They're in the bassinet. They're breathing so safely, whatever it is. For a NICU family that says that, they may have literally seen their baby stop breathing. They may have seen them struggle to breathe. They may have been told at discharge, your baby is at high risk for RSV or being readmitted from a virus. So there's a certain level of vigilance for a NICU family that is appropriate and is different than a non-NICU baby. But for many families, it's like, where does this healthy-ish, appropriate, situationally appropriate anxiety end, and where does like really like this level of anxiety that's impacting their quality of life? The line is really murky, a lot murkier with NICU families because they are dealing with oftentimes infants that are at higher risk for complications like SIDS and being readmitted and all these other layers that worry most parents are at high risk for many NICU babies. Then we have postpartum physical care. The amount of times that I've had a NICU family come into the NICU and be like, basically, they just forget they gave birth. They do not care. They can be bleeding in a hard plastic chair, and they're like, I'm not leaving my baby's bedside. Like, they immediately go into mama bear, fight or flight. I'm here for my baby. My own needs are zero. And then the rate of readmission for NICU families is so much higher than a non-NICU family because the NICU environment is not set up really for families. The buzzword is family-centered care, but there's often not a great spot for a family to rest and recover in the NICU setting and still be with their baby. We, in my own NICU, I worked there for 10 plus years, and only until the last 3 years do we even have pads for families, peri pads. It used to be just an afterthought because NICU care providers are trained to care for babies. They are not trained to care for a postpartum family. But the family, unlike most other settings, if your loved one is in the hospital and they're recovering from surgery, it's unlikely that you, as the loved one, are also recovering from a major physical health journey as a person who gave birth. So their own postpartum care is dismissed or not given, and people who would otherwise be able to support that are often not allowed into this space or are not invited into the space. And so it's hard for families to show up and parent and advocate if they haven't eaten, slept, peed, changed their pad, anything in that period of time. So that also, no, people cannot have mental wellness if their physical needs are not met also. Like it's much harder to be mentally well if you are physically unwell. And then we have that isolation and otherness that we talked about, where NICU families don't really know where they fit in. They feel like they're not really allowed to share their story in the same way. They might be, a lot of times people are getting these like, toxic positivity statements sent to them, like, at least you're in a good NICU, at least you get to go home at night and sleep. And they just feel like there's no one they can truly share their deep grief and sometimes anger and overwhelm of what is going on with their body and their journey into parenting. This is a quote from the Birth Trauma Mama, and it really, I think, ties in this idea of preparation for birth and how that culture is kind of hard for NICU families and can kind of shift the narrative. So hers is when we claim that preventing birth trauma is solely based on your preparation for birth, we place blame on the shoulders of survivors, further compounding and their trauma and isolation. So oftentimes there's this idea, again, like if you do the birth planning prep, if you get the doula, if you hire the midwife, if you take the prenatal classes and eat well, you are not going to have a NICU stay. And it does decrease your risk, right? Having great health care and having a positive pregnancy decreases your chance of a NICU stay. But it isn't zero. No one has a 0% risk of having a baby with a NICU experience. So when that does happen to families, it can feel really overwhelming and intimidating and hard to talk about, especially if they are a family that was in a environment where they really wanted that low intervention birth and they really were hoping for a home birth and they were hoping for that midwife delivery. And now this is their story too. So this is kind of similar to the other slides, but just slightly in a different way. But one thing I wanted to highlight here is oftentimes NICU families have people in their lives that want to support them. They might have friends or family. They might have a doula that they hired, but these people they don't know how to support families through a NICU experience. They don't know what to say. They don't know how to step up. And so oftentimes they're like, you know what, we're just going to back away because we don't want to say, we don't want to do the wrong thing. We don't want to be a bother. We don't want to add to their load. But then these families, I literally see it in the NICU, they're looking around like side to side and they're like, where's my village? Like they are not here. Like I am just doing this all by myself. And this happens oftentimes, and one of the reasons why I created the trainings that I do is with doulas. I've had so many families come and be like, yeah, I had a doula. But the second I went into preterm labor, she sent me one text and that was it. And she's like, I didn't feel supported. Like I wish I had someone that could doula me through this type of an experience because I was really scared and really overwhelmed and I needed resources and I needed support. So oftentimes this missing support is through the NICU stay, and then we have this other gap of time, which is discharge. So a lot of us in the perinatal birth community have read the first 40 days book, where it's like that first 40 days postpartum. There's these physical changes. You want to be in the bed, around the bed, out of the bed. That doesn't happen in the NICU. So my theory is that the first 20 days are happening no matter what, whether in the NICU or at home, your physical body is having the same changes that they would be having regardless of where your environment is. But my second piece of this theory is that the second 20 days happens whenever they're discharged, whether that is 2 days later, 4 weeks later, 4 months later, a year later, that postpartum, like getting to know your baby, building a routine, bonding, connecting, resetting post birth happens for NICU families at discharge too. So the other place that I see lack of support is people are like, you made it through the NICU, two thumbs up. Now we don't need to support you anymore because everything's fine and you're home now and everything's normal. But that is often, as we saw, when a lot of these mental health concerns pop up and show up for families too. And again, they're feeling, okay, now I'm really starting, now I'm alone and I'm doing this all myself, and there's no one there to help support me too. A few just basic mental health resources I want people to have as they're kind of going through this and you're like, okay, how do I help my families? There's a couple big ones just to know. One, if, and I'm sure we all are very aware of this, is PSI, which is Postpartum Support International, and knowing your state's local chapter as well, because there is a warm line. So if your family is needing support, you can help by as a doula or as a support professional calling on their behalf and helping connect them with people who have openings to offer clinical mental health support. There's also two nonprofits, Project NICU and Hand to Hold, that offer free professional mental health support for NICU families. They do it both in slightly different ways, but they're great resources to have in your support professional toolbox of ways, especially because for some families, the cost of mental health support is a barrier to getting those resources that they need. And then some NICUs and other communities will have support groups specifically for either perinatal mental health issues or even better for NICU families specifically. If they can't do something in person, Project NICU and Hand to Hold also do have virtual support groups as well, because sometimes people just want to be able to talk freely about their NICU experience. So that's the families. And now we're going to talk a little bit about the babies because they have their own story and their own experience and their own sensory lived journey through their NICU stay that makes them quote unquote different from the well baby trajectory. And this is not just for preemies. This is all babies that have gone through a NICU experience. Preemies have their own kind of nuances too, but in general, if they're babies in the NICU, there's something going on physiologically with their body. So in the NICU, oftentimes babies are having a hard time breathing. They might need some breathing tube or a cannula and support. And so this line here is like discharge right here. So oftentimes people think like, oh, now we're fine. But oftentimes these babies again have higher risk of complications from illness. They have a greater risk of long-term risk of asthma and childhood respiratory issues. In the brain and nervous system section, a lot of these babies, sometimes if they're preemies, they might be forgetting to breathe. It's called apnea. They might need a low stim environment, be super sleepy. Or on the flip side, they might be super hyper aroused and irritable, which can lead to feeding challenges. They may have temperature instability. And oftentimes this follows babies home. The NICU is a really uncomfortable place for a baby to be. And we do a lot in the NICU to try to mitigate that by making a more womb-like environment, offering neurodevelopmental practices. But the reality is they're in a kind of annoying place where people are touching them all the time, not always positive touch, sometimes painful touch. And so this is gently, or not so gently, wiring their brain to be hypersensitive to stimuli. So these, especially if the negative experiences are not being directly balanced by positive experiences while in the NICU and at home, they are learning to kind of be in their own fight or flight state, which can lead to higher rates of, quote, colic, or being a harder to soothe baby, or a fussier baby, having a lot of sleep issues, or needing to have additional feeding support, temperature sensitivity. A lot of babies still have a hard time. They get too cold or they overheat. GI system is another one that follows almost every single NICU baby, especially preemies home, is in the NICU. We're turning on systems, body systems, like a GI system to eat that isn't supposed to be on, especially preemies. We're like, okay, now you have to digest. And so their little GI systems are still growing and developing. And at home, this can look like a lot of reflux, constipation, infant dyschezia. So that's the grunty groanies. If you've ever worked with a preemie, they're all like all the time, sound like little goats, clinical GERD. And then there's also the growth and development. So in the NICU, a lot of times there's extra calories, fortifiers, supplements. They're seeing PT, OT, speech, all these different people. And oftentimes that follows families home. They're going home with a lot of appointments and cooks in the kitchen trying to help their baby feel supported and have the best possible outcome. But in the NICU, that's being managed by the medical team. And at home, it flips immediately to the family having to manage all these providers and opinions and appointments and also care for their baby too. So again, a lot of people think that there's this line in the sand and everything's fine. But the NICU follows families and babies for a very long time, even if it is a easier or a shorter NICU stay. Oftentimes in the NICU community, if you're in like the chat and the Facebook groups, NICU families will undersell themselves. Like, I only had a week stay, or I only did this, knowing that some families are in the NICU for a year. But it still impacts their transition and it still impacts their baby's transition from their birth throughout their birth journey, and especially for that first week to year of life at home. So how can do the first part of this, which is kind of a bummer. So how can we make this better as doulas and other support professionals? The first step is to allow for prenatal preparation and empowered decision making. This comes from talking about it, about from having conversations with people in your world that are pregnant and allowing them to have a better understanding of the NICU so that they can make informed and empowered decision making if and when the NICU is part of their story. This also helps to destigmatize that experience. So if, like we said, if people are only seeing one version of birth, they think, again, if it happens to them, they must have been the only one. If, especially as doulas, we are people that they are picking. They are looking and scrolling and interviewing us, and we are their safe person. And if we never mentioned the NICU at all, and it was like not on our radar, they're like, I am the only one of Mary's clients that ever had the NICU stay. I must have done something wrong. I failed my baby. My body couldn't do it. All these inner loops that we hear from NICU families. So as their safe person, as their doula, if we're gently introducing the idea of a NICU, again, from a place of informed and empowered decision making, not from fear, they can feel like, okay, this is part of my story. I got this. Like, my baby and I, we can get through this. Like, it's not ideal. Do I want to be here? No, but we can do it, and we're going to feel empowered while we do it. We're going to do it on our terms. And that also comes from informed emotional support too. The NICU, even if we have an amazing support team, still can feel like a trauma to families because it's the NICU. You're still separated from your baby. You're still feeling, there's a lot of fear. There's a lot of unknowns. There's a lot of stress. And so we can help mitigate that, but knowing how to speak to families in a trauma-informed way can help to mitigate their own trauma and how this stressful experience is like imprinted in their own body. You know, the book, the body keeps the score. If we can help their bodies throughout this experience by allowing them to process their emotions and feel safe as they can, they're going to have a better long-term outcome. Connecting with evidence-based resources. We do a really good job of this with doulas, with helping them make decisions around their choices in birth, choices postpartum. We don't tell them anything about choices that they can make as a NICU parent. And so they may have this brain where they're like, I know exactly what I would have done if I was given the choice for an epidural. I know exactly what I would have done about the hepatitis B vaccine. I know exactly what I want to do for my pediatrician. And now I'm in the NICU and I want to make these informed and empowered decisions. I don't even know what resources to use to get this information. And it's like they're learning by fire hose, like it's being sprayed at them, and they're like, "Oh, I don't know." So as a doula, having some resources that we can connect the dots so they don't have to do the middle of the night Google. We know these safe, trusted ways and have our own understanding of evidence-based sources that isn't just rooted in, well, my neighbors preemie did this. That's such a gift for families. I feel like the work of a doula is to offer emotional support and connect with resources so people can make informed decisions. Like that's our magic the gap, one of the biggest gaps that we're filling, especially in the NICU setting. We can help facilitate postpartum healing so that their bodies can heal, so that their minds and their ability to connect with their baby and show up for their baby and parent their baby is there. They don't have to think about all these other bodily things that are happening. Their immediate priority needs are met so they can then meet the needs of their baby. And then if you're somebody who works after with NICU families, especially as a postpartum doula or newborn care specialist, is understanding the unique needs of the babies as well and helping parents step back into the role as primary parent. That is a huge piece of the work that I do is helping kind of deinstitutionalize NICU families from the clinical rigid scheduling of the NICU and back into owning their role as someone who knows their baby best and can make informed decisions on behalf of their baby and advocate and really step back into that role. But doing it from a place of understanding and knowledge about the unique needs of those babies as well. So, NICU families face a uniquely challenging and emotional journey, and they deserve compassionate and tailored support. Doulas, with our already present expertise in emotional practical care, are uniquely positioned to provide this crucial support. And so, by offering your presence, advocating for families' needs, providing informed guidance, we can help transform that NICU experience from one of crisis to one of true comfort, hope, and even empowerment. So, I do have a guide that if really sums up a lot of what I talked about. So if you want to have like a tangible resource from this, if you want to refer and have some statistics, there's also a connection in this guide too that includes the option to get I have a NICU toolkit for doulas because a lot of times I've had doulas say that they're like, okay, Mary, like I want to have these conversations with my families, but how do I do that? So the script itself or the actual PDF is free, but a lot of people wanted more support of like how to have these conversations. So the NICU toolkit includes some scripts, it has the template, it has trauma-informed language swaps, and it has a step-by-step video. So if you just want some place to start, I packaged it all up so you don't have to figure it all out yourself. And then if you want to go deeper, a lot of times when I've had this conversation, and doulas instinctively, we know our own gaps in care, and we're like, I don't want to be that doula that walks away. I don't want to be feeling like I want to help my families and my babies, but I don't know how. I took all my nurse experience, my nurse educator experience, my doula experience, and I wrapped it all up into two different options for continuing education for doulas and for other support professionals. So, navigating the NICU for doulas, I kind of think of this as like the missing module from your doula training that speaks specifically to NICU care. So, it's self-paced, it's about 4-ish hours of content that's pre-recorded, plus you get a lot of handouts and templates. So you get a NICU 101 cheat sheet, you get some more trauma-informed care, you get a NICU resource list. So I was saying like there's evidence-based resources. It's a whole massive Google Doc of different vetted studies, resources, books, tools, websites that you can use for yourself or for your families. And then for those that want to go deeper and specialize, I started NICU Doula Academy, which is the first ever NICU Doula certification program. And it's accredited for 30 contact hours through ANA, which is the American Holistic Nurses Association. And it is 10 weeks of 30 plus hours of training, both self-paced, and then we have a live weekly cohort. And so that's really diving into this role as a professional role. A lot of the graduates are working full spectrum. Some are really honing in on prenatal education as a complement to their birth doula training. I have one grad that's doing bedside rounding with antepartum patients. Another that's starting an inpatient NICU doula program at her local children's hospital. Some are doing private practice like I did and helping families transition to home. So the possibilities are really limitless. But we really come together to build this network and alumni group of people who care deeply about NICU families and also about changing, really revolutionizing NICU care. So if you're interested in either of those, they're on my website. NICU Doula Academy is cohort based. So the new cohorts don't start until 2026, but there's a wait list that you can join, and you can be the first one to find out when I announce those dates. And then Navigating the NICU for Doulas is available if you just, a lot of times doulas will email and be like, I have a client in the NICU. How can I help them? And I'm like, I have this for you. It used to be live, and people are like, no, I can't wait. So it's there now. But together we can bring more joy and less trauma to the NICU experience for babies and their families because the NICU is only the beginning. And it's chapter one, and it can be a really intense chapter, but it is just the beginning. And if we can help families navigate chapter one in the most meaningful way for them, then we can celebrate these beautiful first birthdays and find even more joy. So here's my website. The QR code works if you want to. And thank you so much for having me. I'm happy to just hang out and have a discussion, answer any questions. Sally, if there's anything in the chat, I knew I said I was going to pause and I did it. Excited, but happy to talk through whatever anyone wants to. And I can stop sharing my screen too.
Awesome. Thank you so much, Mary. This was insanely informative
Oh,
and
good.
so interesting. Anyone who has a question, you can unmute and ask right now or pop in the chat. Feel free just to start talking. You don't have to raise your hand if you don't want to. Um, this was really great. I really, really appreciated the mental health component as well. I highly recommend everybody finding a few people to refer to for mental health that specialize in this area as well. Mary, do you have people that you specifically refer to? I know you mentioned PSI and a few of those different groups.
So I always encourage if you are, a lot of times NICU doulas are working within their specific community. So trying to find a couple people in your space that really speaks NICU fluently. With my own experience, this was a lot of kind of trial and error and finding people. There isn't a great that I've found like database nationally of people that really specialize in NICU support. But a great place to start is always PSI and talking. They also have a, or at least in Virginia where I'm at, they have a NICU family support group too. And so may also have some references and resources in that area. I've also found, I mean, social media gets a bad rap, but if you, the community that you can find on like a local Facebook group, or asking a lot of if you have the connection with a NICU doula, you can have, we each of us have our own list of vetted resources in the area. And one thing I forgot to mention that's coming out later this probably in the next 4 weeks, is the NICU Doula directory. So I'm having a resource list of every graduate that's gone through NICU Doula Academy, where they are in the country and the world, so people can have one hub to try to find a NICU informed doula. And if you've gone through the training yourself, it's a way that families can have a one-stop shop and be like, okay, here's the people in my area, here's their website, here's what they offer, and really make it like a thing. Because when I've started the I wear both hats, right? I can speak NICU admin, I can speak healthcare admin fluently, and I speak doula fluently. So my goal is to, and most sometimes these two teams don't always play nicely together. So my goal is to really sell it to healthcare admin in a way that is very clear the benefit that they can get too from allowing NICUs and doulas that are informed and safe, because we always want to make sure that people are safe. The NICU is a more vulnerable environment, but showing how that can impact not just the baby and the family's outcomes, but healthcare teams too are burnt out and have compassion fatigue and have limited resources, staffing, availability, training themselves on how to support mental health of families. So having someone that can step in and fill that gap, like literally everybody wins. So I'm trying to make this a big thing. Like I don't want to just have people trained and be like, off you go. Like we're making the momentum. I'm going hopefully going on a big tour, a medical conference tour next year and trying to weasel my way in with NICU informed doulas and NICU doula care. And really have the studies and the math to back it up too, because it's there. It's exciting.